So we had a hot take last week.
Legs are overrated when it comes to power on the serve.
That's controversial?
Yes.
Apparently an unpopular take. So we got a leading sports scientist who was also a former NCAA doubles champion to tell us why either we're right or wrong, and to dive into other sports science hot topics. Dr. Mark Kovacs, welcome to the Changeover. Welcome to the Changeover Podcast. My name is Justin Roberts, and I'm with the co-host Jody Maginley. A different one today. Normally we're telling stories and talking a bit of shit, but today we're gonna learn. Get the notebooks out. I have one of this guy's machines, the Mark Pro. We have Dr. Mark Kovacs with us today. Thanks for joining us.
Awesome. Hey guys, great to see everyone.
Perfect. So how we got here was we actually wanted to get you on the podcast a couple months ago, or a month ago now, I think, and it didn't quite work out. But last week on the podcast, we ended up having a listener send a question about serve speed and power and how they could improve it. And Jody had a somewhat controversial take, I guess, because the comments weren't too happy with us, with the way we answered the question. So Jody, do you want to tell them what the take was?
Sure, yeah. So I guess one of the members of the audience asked how he can increase serve speed, like Justin said. And in my opinion, from what I've seen around and experienced people, the first thing they think about is the leg drive, and they need to put more legs into the serve and whatnot, which I don't disagree. Like, legs are important on a serve. But I believe that it's overrated in terms of serve speed. I think that people can attack the power on the serve from the rotation of their shoulder, and I guess the issue that I have is that I just talk about pronation and as like the wrist snap or whatever, and I don't know that there's so many different, you can break down so many different technical movements. So I was describing the rotation of, I guess, loading the shoulder and rotating the shoulder and exploding through, and snapping the wrist. And obviously there's a lot of components that goes into the serve, but in my opinion that the legs are overrated when it comes to power. And initially, a lot of people overlook the other parts of the serve when talking about power. So, like Justin said, the comments were telling me that some of them were agreeing and some of them were disagreeing, and they were hinting that we should discuss it with you. So,
Awesome. Yeah, no, it's a great topic. I'm glad you brought it up and glad that the people are having a discussion around it. That tells us that we need more education around this topic if there's two sides or two discussions going on. So I think what you were probably leaning towards is the importance of arm action, which we know is vital for the serve. So there's no doubt that the arm action is the last part of the movement before racket hits ball. That has to be fast, that has to be explosive, that does produce a lot of the power on the serve. So you're right in that context. I think the question is, how much does the legs contribute? And we developed this 8-stage model to the serve to sort of look at this about 15 plus years ago, and we used the baseball model of pitching originally and then adjusted it to the tennis serve. So there's been a lot of good research done in great biomechanics labs around the world that has tried to get at this question that you're trying to answer. And it is complicated. It's not as simple as the legs are the power source and the arms aren't, or the arms do everything and the legs don't. It's this combination of summation of forces from the ground up, through the body, into the arm, and finally out into the racket and into the ball. So there is a technical component to this that a lot of people miss. It's not just how powerful are your legs. We can get someone who's got a 40-inch vertical and they're going to serve like trash, because they don't have good technical components to execute, even though they have unbelievable, jumping ability and explosiveness. So that's the technical piece. So you need that in all these discussions. So that's a huge part. But if you're simplifying it, how much do the legs contribute to how much do the arms contribute? It's anywhere between 20 and 50% for the legs. So it's a significant amount, but it's not the be-all, end-all, as you mentioned. You know, we all know people can stand there and serve without jumping and serve hard. They're still using the ground though. It's important to realize that even when you do that, there is a ground reaction force. Wheelchair athletes, for example, if they have the ability to push into the chair, they serve significantly harder than a wheelchair athlete who doesn't have the ability to push into the chair. So if they just use their upper body, they serve a lot less. So there is a leg component, and the leg is more the ground reaction forces. It's not a knee bend question. I think that's where we see, if we look at the top pros, two great servers that have different leg drives. Think about Nick Kyrgios and Ben Shelton. Both great serves, both hit it very hard. But if we look at their knee bend, they go at a very different depth. The two things they have in common, though, that make them serve so well is how quickly the back hip drives up. It's called vertical hip displacement. So how much height and how quickly does that hip move off the back hip. So for a right-hander, it's the right hip. For a left-hander, it's the left hip. That's really, really important. It's not the depth that they go down. It's how explosive they jump up. So that's number one. Number two is the arm action. And it goes from the cocking stage or the racket drop stage of the racket through and past contact. That speed of that movement is vital. And that is where mechanics play a huge role. Because if you don't have the right mechanics, if your racket drop position, that, it's called stage 4 in the model, if that position isn't optimized, you're not going to get that length and that speed of the racket through. And all great servers have those two components. They all look a little bit different. If we think of Serena or John Isner or Pete Sampras, they all look a little bit different in their style, but their fundamentals are nearly identical. And that's where we spend most of the time focused on, is what are the fundamentals. So hopefully that sort of gave a little context and background into the discussion, because it is a good discussion. And as we know with online discussions, they're usually one or two sentences. Legs do everything, arms do nothing, arms do everything, legs do nothing. It's a little bit more nuanced than that.
Yeah, I think people were missing, like you said, it's very extreme a lot of the times when we say things, and all I said was, in my opinion, legs were overrated when it comes to power, and I didn't say that legs doesn't exist when it comes to power. And I do believe in the kinetic chain and power from the ground up. I do 100%. But my question is, sorry, go on, Justin. Go on.
I was gonna say, but I said try hitting a serve with no arm and just jumping up in the air. So I think maybe I took it a little too far.
But if you were posed that question, I know it's impossible to answer without seeing. But if you were posed that question, how you can increase power on a serve, what would your answer be?
Yeah, there's really two ways. There's only two ways, really. And it's that back hip explosiveness. It's not the depth of the knee bend. It's how explosive you come out of whatever knee bend you're in. Some players can go really deep and explode really well because they have leg strength. They're built like an athlete who can do that, but a lot of players can't. So you need to go a little less depth, but then come out quickly. So that's number one. And number two is that arm action. So you actually go from a supinated position down here into a pronated position, past contact. So it's called long axis rotation. And long axis is just the arm. It's the shoulder, it's the elbow, and it's the wrist. Too many people break it down into just pronation. Some people talk about wrist involvement. The wrist doesn't really have a lot of involvement by itself. It's the end of the motion. Everything else has to contribute first. The wrist sort of comes along for the ride. Some people, I think, talk about the importance of the wrist. The wrist is not vital. It's a end point of a much longer aspect of the motion. So everything plays a role, so you don't want to downplay any one of those components. But if the shoulder motion isn't optimized, the wrist is very, very secondary.
What are some common, let's say, serve power myths? 'Cause I remember growing up, they used to talk to me about pushing my left hip into the court to kind of create like a bow action. Is there anything else that people come to you with often that might be a mistake when thinking about power?
Hey guys, quick break from the episode. The best way to support us is to like the video, subscribe to the channel, ring the notification bell so you don't miss any of the upcoming videos. Thanks for watching and enjoy the rest of the episode.
Yeah, so we talk about this a lot. So in one of the courses we do for mainly for coaches is focused on what are the big sort of coaching errors or coaching misses that have been talked about for decades that are actually just purely wrong. And the one you mentioned there, the bow sticking the front hip out over the baseline, is a result. It's not a cause. So if you look at great servers, they all do it. Andy Roddick, Pete Sampras, there's a bunch of them that have pretty excessive movement there, where the front hip is out over the baseline. That is what you want. However, that's not the cause. The cause is the back hip actually rotating back and down slightly, which allows the front hip to move up and out. So it's all about storing and releasing energy. Your goal is to store energy back and down so you can release it up and out into the court. So the goal isn't to just stick your front hip out. And unfortunately, and we saw it in the late 90s all the way through the first decade of the 2000s, a lot of really bad servers because of that myth. And mainly on the women's tour. You saw a ton of it happen on the women's tour in the WTA, where everyone shifted weight very early into the front leg and there was very little load on the back leg. And as a result, they opened up very early. They had a lot of ab strains, a lot of adductor strains. You saw that tape on the left leg of a lot of right-handed tennis players on the WTA. Much of that was due to poor serve mechanics.
So talking about the load, is it possible to load too far? Because I imagine that the lower down you go, the harder it is to come up. So that's also somewhat of a misconception, right? In terms of like how much legs you use in the serve.
Yeah, so with good players, players that are trying to play high-level juniors, college, pro, majority of them actually load their legs too much. And we analyze this using force plates and other things to show them the data. And what happens usually is players actually go too deep and they get stuck at the bottom. So every millisecond that you wait at the bottom, you actually lose energy. You dissipate energy away from where you want it to go, which is up. Think about, if you look at the NFL Combine, if we look at people that do vertical jumps in the Combine, they don't go super deep in their knee bend. They go down deep enough to use the ground as much as possible, but they want to use as much of that stored energy as quickly as they can, because every millisecond they wait in the bottom is energy lost and they'll never get it back. So you want to make sure the moment you get down to whatever that lowest level is, you immediately get out of it and you explode up. And for most tennis players, they go down too deep. It's one of these, I think, misused cues of use knee bend more instead of use knee bend less, but be more explosive coming out.
Okay. And something we didn't mention yet, but this is, I guess, part of, we didn't discuss this for that long in the last episode, but a very important part of in my opinion, on getting the right power and action on the ball is like the actual contact of the ball. And I learned this from Taylor Dent. Justin and I both used to, and Evan, who was actually on the last episode, we all used to work with Taylor Dent, and he's very he stresses a lot the impact of the ball, of the direction you're swinging the racket and the part of the ball that you're making contact with. So don't you think that if you make the wrong contact on the ball, that could affect or impact both the power and the spin and direction of the shot?
100%. It's just like shanking a forehand. If you don't make the right contact with the strings on the ball, you can do everything else right and you're going to lose a lot of energy into the ball. So there's no doubt that all these steps have to be done correctly for you to maximize your power or speed on the serve. If any one of these steps is off just by a little bit, that's where we see big reductions in serve speed. Even at the top of the game, why do they serve at 130 and then 138? There's an 8 mile an hour difference many times, and they did pretty much everything the same. They were just off in little pieces when they're trying to hit a flat serve down the tee, for example. So even the best in the world can't every single time hit the exact same miles per hour. Similar with golf. With golf, when they're driving, if they're off by just a little bit, that drive distance can change by 20 or 30 yards. So it's complicated. I mean, that's the good and bad part about the serve. It's the most controllable shot in the game because we control it, but it's also the most complex.
A guy like Stan Wawrinka, who served kind of straight on, like his right leg would come to the outside of him, but he was still serving like 130, 135. I mean, maybe he wasn't as accurate. He would miss quite a bit. Would he have had more power and also more control if he could have that better, like you said, that hip, I guess, coil and then quick release, as opposed to being so open and not really using his hips as much in the serve?
Yeah, no, Stan's a great example of someone that got a lot out of his serve, obviously. He could hit it really hard, but he didn't maximize his serve. He was never considered someone to be like, hey, he's one of the top 5 servers of all time or top 10 servers of all time, which arguably he could have been. I mean, he had enough ability to do that. What he did do well was he rotated his hip slightly. Even though his leg position wasn't great, he was able to get that 10 to 15 degrees of rotation in the hip, which allowed him to get into the hip. And he had a very low, like he didn't go very low in his knee bend, similar to, say, a Kyrgios type, but he got out of that so quickly. And that's where he got a lot of all his good stuff. So he still used his legs a lot. Like, it wasn't like he wasn't using his legs, but it wasn't as obvious, let's say, as someone else who goes a lot deeper.
But is it about getting the back hip around, or is it getting the back hip down?
Both. So it's a great point. I'm glad you brought that up. It's not one only. If you just rotate and you don't go down, that's not good, because then you're going to over rotate and you're going to spin out of your serve. You're going to open up too early. If you go just down, then you're just doing a dead squat and you're going to go straight up. And when you go straight up to make contact with the ball, you're going to open up too early. And you see that a lot with players where they collapse at contact because they've gone straight up with their lower body. And then the only way to make contact with the ball that's out over the baseline is to collapse at the chest, and then you're pulling down. And that's where you get a lot of the lower back injuries and the ab strains and a lot of shoulder problems as well. Because if the legs and core don't do what they're supposed to do in the right trajectory, then the load on the arm goes up significantly. So there's a huge injury risk piece to serving the wrong way, and it's a real problem. That's what a lot of people come to me for, is they come with an injury and they're like, hey, my shoulder's got a problem, my elbow's got a problem, I feel it on the serve. And then you look at their serve and you can nearly every time see why. It's a very clear linkage there, and the data shows that as well. When you look at biomechanical data as to if the legs don't do what they're supposed to, and if the body doesn't stay side on correctly and it opens up too early, you get a lot more forces going through the shoulder and the elbow at contact.
You talk about cause and effect. Since we're talking about power right now, would I talk to you about people missing the serve long and in the net? Do you normally see certain reasons why each one happens? Or not really?
Yeah, so normally when they're missing in the net, normally they're doing something that they've opened up too early a lot of the time. So they're collapsing, they're not getting their body in the right, it's really called that shoulder over shoulder, hip over hip position. They're not staying side on long enough and they're opening up very early. And as a result, they're pulling a lot into the net many times. You know, there's always examples of other reasons why, but that's the main issue with missing in the net a lot. Missing long a lot has a lot to do with ball toss location many times. If the ball toss is too far out in the court, many times that's an issue because they don't get their long axis rotation right. And, you know, some people will call it, you know, high elbow or thumb down position. When you're throwing, that's a very common cue for football quarterbacks, baseball pitchers. You know, so when you're coming in that position, so if you think of Sampras as an example, Ben Shelton, Francis Tiafoe, they do that unbelievably well. They have a very extreme position there in a good way. So that's an example of how you bring the ball down typically. So if you're missing long, most club players or lower level players don't do that very well. And the older someone gets, the more stiff their shoulder becomes, the more restricted it becomes, and that becomes harder and harder to do. And that's where you see a lot of the problems with club players is they miss long a lot because they don't have that easy ability to get that long axis rotation of the shoulder and the elbow and the wrist in the right position. So that's what you want to train. But you also got to understand physically, are they able to do it based on any limitations or restrictions they may have?
So when I hear you break down the serve, obviously you there's a lot of different technical terms that we can use for things. And a lot of them is new things that Justin, I don't know about Justin, I must speak for Justin, but for myself that I've heard today for the first time. And I watched a little bit of one of your talks on YouTube, and a lot of terms I heard for the first time as well. So when you're breaking down the serve and trying to educate people, is your goal mainly to educate coaches, or is it players as well? Because from a player's point of view, my opinion is that there's only one or two things that we can focus on at the right time. And when we break down something into so many different pieces with so many different terms, it gets a little bit complicated for me. So one example is when you were talking about missing the serve long and the toss being too far forward. Like, I agree with you. And in my opinion, it would just be because if you toss the ball forward, the only way that you can, if you're going to swing like a normal swing, you're going to meet the top of the ball and hit it straight down. The only way to adjust is if you open the face and hit it flat. That way it doesn't have that action on the ball to bring it back down. But when you described it, obviously there were lots of terms and different reasons why biomechanically. So do you think that in tennis there's this, I guess, over-complicating things? And not from your point of view, because obviously you're well-researched and everything means something. But for the common I guess, player and coach that's just trying to learn and teach, do you think that's an issue in tennis?
Because when I'm hitting the ball, sometimes what I think about is not what I'm actually doing. So sometimes I will have the feeling, if I'm going to hit a serve on the right part of the ball, I'm thinking to do like a hammer on my hand like this. But if I look at the video, I'm actually pronated. So like what I'm feeling and give myself as a cue is not necessarily what I'm actually doing scientifically. So I think just it kind of goes to what Jody's saying a little bit.
Yeah. There's real and there's feel. We talk about this in all sports because I work with baseball, I work with soccer, I work with golf. So it's the same issue. Players are not usually good coaches, great players, because they feel something that isn't actually real, but it works for them. It's a cue. It's a feeling that they have. So you have to be really careful when you try to interpret great executors versus great coaches. Great executors can do it unbelievably well, but they may not know exactly why they're doing it. Great coaches typically understand the why, theoretically, but then very few of them are great coaches because they don't know how to communicate it to the players. So what we've been talking about today is very much coach speak. I talk about, this is coach speak, coach to coach, education, learning, details, being right in how you analyze and how you assess. But then I also work with players, and when I work with players, I don't use any of this language. It's very simple cues. It's bring your ball toss back, less legs, simple 2-3 words that they can do immediately, they can feel, and then it gets to my outcome. So obviously, coach speak to coaches is very different than player speak. So I'm glad you brought that point up. So hopefully people don't get confused and be like, hey, I should be thinking about this when I'm serving as a player. Because I was a player, so I definitely understand you don't want to have more than a couple simple cues in your head when you're trying to get up there and hit.
Exactly, because that's what I think. So like when you talked about, and I guess we can discuss this now. So when we talked about that left hip, I'm right-handed, so my left hip coming like over the baseline. Mm-hmm. I have certain cues that I think about when I serve. So I know that that my action is faster than a normal action. So a lot of the times when I'm out of rhythm, it has to do with my toss being probably too high because I don't want to be waiting that long for the ball. I know I have a fast action, so I want to toss slower. So that's one of my cues. But another one of my cues is when I feel that collapse happening, I feel like I'm rotating too early, I think about getting my left hip into the court because it just makes me stay in that trophy position just long enough so that I don't, rotate into the serve and hit the ball before I'm ready to hit the ball. So what cues do you think players should focus on? A few cues that they can think about in different scenarios, kind of like what I just described. Are there any important ones in your opinion?
Yeah, so there's a lot, and it depends on where their, say, restrictions or limitations are sometimes. But a lot, if they're dragging their foot up into a pinpoint, for example, making sure that they push into the first third of their foot well when they drag their foot up in the load position. That's one.
What do you mean by that?
So if you've got your right foot and you're sliding it up into a pinpoint, and as you start to load the legs in that position, too many players are on their toes many times. so they're not getting a lot of drive into that back leg. So pushing into that ball of the foot properly
Really?
is really, really important. That's one that a lot, like, that's a big change Sabalenka made. If you watch her, when she brought her foot up, she started to really push hard into that, and that
Into
helped,
the right foot.
Yeah, into the right foot, and that helped her stay in the position so that she could go up and not spin out of it so early. So that was, that's a cue for a lot of players that do have pinpoint and that don't serve so well. So that's one big one. Another one, if people are opening up, if they're doing everything right, but they're still opening up a little bit, is keeping their left elbow into their midline of their body. And that's in baseball, they call that glove side mechanics when you're throwing. So you're actually dragging your elbow into your midline of your body. And that's similar to boxing. If you want to punch someone, the opposite hand goes into the center. And tennis players typically open up too early with that left arm. And it's not really the left arm that's opening up. It's the hip is over-rotating. The right hip is over-rotating. And it's causing the body to fall to the left for a right-hander. So you're trying to minimize that position. So those are two big ones early in the motion that if you can get right, the rest of the motion usually takes care of itself because your body's aligned right, your energy's going in the right spot, and then it's just arm action. And then it's just let that arm go and really get through it. And then that last one is what coaches will use the term pronation, which I don't love the term pronation because it's so minimal in what it's describing. Pronation is just from here to here. That's all we're talking about, just that motion. Whereas what we really are talking about is this motion, which is shoulder internal rotation, which is really more important because we got to get shoulder internal rotation to get to full pronation. And a lot of players don't get that position right, especially players that can't hit a kick serve well. That's one of the limiting factors on a kick serve. And then, so those would be 3 or 4 sort of cues that I think most players at a lot of levels, even the highest levels, struggle with.
It's funny because I step up and I feel like I use almost all left leg. Like I know I do use some right leg, but I don't pay almost any attention to how much drive. And maybe I'm doing it subconsciously, but like my opinion has always been if it's a platform serve, maybe the balance is closer to 50-50. Not that it is, but it's closer to 50-50 than it would be if someone's stepping up. My opinion has always been if someone's stepping up, most of the load is going to happen in the left leg because that's the leg that we push that hip out into. So am I incorrect in that?
So it's all about timing. So I think people simplify it way too much, which is normal. Is it right leg? Is it left leg? Is it 60-40? That's a number a lot of people throw out. I use that as an example if someone wants a headline number. But you got to talk about where in the motion. When you're getting into stage 3, which is loading, there's actually a specific time point when that happens. That's the lowest point your back hip is at before it starts moving up. That's the point where you do have more weight on the back leg than the front leg. But as that hip starts to move up, and that's his milliseconds we're talking about, weight is shifting onto the front leg. You're coming up from the back leg, but there is movement into the front leg. So a lot of people that say, well, I feel like I've got more weight on my front leg when I'm serving, you're not incorrect necessarily. It's when in the motion are we talking about? So hopefully that clarifies it a bit because there is a back leg requirement of load first because you're shifting weight. You have to shift weight from back to forward for you to be moving into the court in some degree. So that's the important distinction. So a lot of time when people say, I feel like I'm just using my front leg and I'm serving well, it's when you actually break it down and measure it, you're like, you aren't using your front leg, you're using your back leg first, but your front leg does a lot of work towards the end of the jump.
Okay. And sorry, Justin, I know I'm asking other questions. I don't know.
Do your thing.
So how important is trophy position to you? Because when I think about the serve, or at least the throw-in part of the serve is what I mean, I guess we can describe it as, or I can describe it as. But I think that it's similar to throwing a ball, except instead of the plane being like straight forward, you're throwing it like you're throwing up, right? How important is getting, like I was taught as a kid and stuff, to like salute, like get the racket like this kind of. How important is that in the trophy position, or does that matter at all in your opinion?
Yeah, so trophy position is really important in general. You have to get the right trophy position to store, because it's really the storing of the energy predominantly in the lower body. So it's trophy position is all about lower body position. A little bit of upper body because you want that sort of 45-degree angle lean from front shoulder to back shoulder. You don't want to be square on. But it's really a lower body position. The upper body involvement is, can you get into racket drop, which is the next stage, effectively from the trophy position. So you do want to make sure that the lower body's correct. And if the lower body's correct, normally the upper body's in the right position as well. So it is really, really important, but it's the step that allows you to get to for the rest of the motion is why it's so important, if that makes sense, because if that isn't right, then everything else is going to be wrong because you got to make up for it somewhere else, and you'll still hit a serve. There are players that hit the serve relatively hard with all arm, and typically they break down in a few years. Their elbow, their shoulder, things like that.
Okay. And then what about if someone, when they're loading, they have the racket face kind of open like this as opposed to closed? Does that make any difference? Because I feel like when guys are open like this, they typically have a slicier serve because they come around the side of the ball instead of like snapping over the ball.
Yeah, so it depends how much. If the racket face is too open, it can be a big problem because you get into a weighted tray type position and you don't get full racket drop. That's the big limitation with that. So there are some players that get a little bit of that and can still get into full racket drop. Then we're okay. So but it's all a matter of degrees, because if the racket is too open at that position, you can't get full racket drop, and like you said, they can't go up on edge with the racket effectively, and that's where the limitation is. So you definitely want to address that, because especially at a younger age, if it's not great at a younger age, it's not addressed, it usually gets worse and worse and worse.
Okay.
Who's the best server you've seen with horrible technique, or horrible, but with real issues in the serve?
I mean, I hate to say that about any good player because I respect him so much, but Venus was the one that I think obviously served pretty darn well, but I had opportunities for improvement with her mechanics and would have probably saved a lot of her issues with her lower back and her abs and some of the shoulder stuff, because she just opened up so early. She had such good leverage though, that she was obviously able to serve really well, but she never really had a kick serve as a result of her mechanics. And for her, how good she is, it would have been great with her height and leverage to see if she would have had a really good kick serve. It would have been unbelievable.
This is where technique is so important, because if you have the right technique, you're not limited in any way. You can do more things effectively. Makes sense.
And that was one of the big differences between Venus and Serena with the second serve, especially, and Serena's control on the first as well. But it's just, again, it's that, if you were going to say who had made their serve work unbelievably well with some real big opportunities for improvement, that was one. And then Sharapova's the other one. Would have loved to have had someone help her when she was a bit younger, because she over-exaggerated that hip-out position into the court, the bowing that you were talking about, and she never got into that rotation, and she never stayed really side-on as effectively. And as a result, she had a lot of shoulder-related issues. Would have been great to see her, because when she came out, obviously her serve was quite a bit better than the last half of her career. So those were a couple that I think would have been really great to have seen if they would have optimized their technique. How many more majors would they have won?
The technique matters. So I'm shocked that we actually spent 35 minutes on talking about the serve. I didn't know it was going to go that long, but I think it was...
about this. Last time you were shocked that the my take was controversial. I knew it was going to be, because I argued with people about this at tournaments.
Also, last week, someone asked you about the doubles return lob, and you talked about it for 15 minutes. I was amazed. But
Dr. Kovacs, you'll be surprised. This guy's going to ask questions and get upset at you for answering the questions that he asked. This is what he does.
But okay, we don't have that much time left, so I do think there are some other hot topics these days when it comes to some sports science. So everybody's looking for an edge. So there are things that the people talk about a lot, which are the enes a lot. So you got caffeine, you got creatine, nicotine, and then the other one would be not an ene, but Adderall, like another stimulant. Could we start actually with the darling on the internet these days is creatine? People talk about 3 to 5 grams a day, and then I've heard other people talking about if you take 20 grams a day, you have like these mental benefits. Like what are the benefits, and are there any cons to taking creatine, and how should tennis players be using this supplement?
Yeah. So creatine's a great discussion. It's been around for over 50 years. It's been studied. That and caffeine are the two most studied supplements out there. So creatine started as basically to replenish your ATP PC system, which is that first immediate energy. If you're going to run, 10 meters or do a vertical jump or hit a serve or play a point less than about 7 or 8 seconds, that's the main energy system that you're utilizing. So if you can get your creatine phosphate levels higher by supplementing with creatine, you can recover better in those environments. So for strength training, it became very popular because that's what you need to lift heavy typically, is to that energy system. So that's why creatine was used. It was mainly in the bodybuilding world, in the sports athletic world as a very important supplement. And so it does that. It does what it's supposed to do. There's thousands of studies that have been replicated that have shown the benefits. The challenges with creatine for athletes that are sweating a lot and that are out in the environment is it moves water a little bit inside the system. So it brings water into the cell, which is a good thing for strength training, but it's a little challenging sometimes if you're sweating a lot and if your heart rate is going up significantly over and over and over again if you're not well hydrated. If you're well hydrated, you're fine. But as we know with tennis athletes, it's really hard to stay well hydrated. If you're playing a 3-hour match, doesn't matter how much you drink, especially male tennis players, you can't replenish your sweat rate. You sweat more than you can actually drink in. So it's a bit of a concern in very hot and humid environments from that standpoint. So that's the main, risk with it. Some people get gastrointestinal issues with creatine, bloating. They feel some challenges there. So you'll know, though, within the first week of trying it, if it bothers you or not. So those are the big challenges. In off-season, in training weeks, it's usually a pretty good idea, pretty useful. It's legal. There's no issues with WADA or the tennis integrity units or anything like that. So you can use creatine, no problem. Dosing is a real interesting question. 3 to 5 grams has been the majority of studies that have been analyzed for sports performance and what we're talking about. The 20 grams or the super dosing that you've mentioned has come from the wellness industry predominantly, and it's looking at cognitive function, aging, individuals that aren't exercising a lot. The hard part with 20 grams is you get a lot of bloating issues, gastrointestinal stuff. I don't usually recommend that for elite athletes because they already have a lot of challenges with stomach stuff, just from all the travel, eating different food, being in different environments. You don't want to add another potential challenge to your stomach. So that's the risk with it. So with older athletes or older clients that aren't playing at a super high level, it could be something to consider for cognitive benefits and, reduction even possibly in dementia symptoms and things like that is something where there's a lot of excitement around high dose creatine right now. But you just got to be a little careful with how you approach that. So that's the creatine sort of discussion.
And what about timing? Does it matter if you take it before, during, after, or is it just doing it daily that's important?
Yeah, the best is usually to take it before workouts that are going to use that energy system the most. So before a heavy strength training session is kind of ideal. It doesn't really matter. You can take it in the morning because it saturates the cells and it's through the body. But in general, if you were going to pick it, you'd like it to have the highest dose in the bloodstream right when you need it the most, which is during a heavy strength session. So usually an hour or two before a strength session is kind of ideal so that the levels are as high as possible that day.
What about caffeine? A lot of guys I've seen, especially like the Europeans, I've seen them taking like the espresso shot before they play a match or like in the drinking the cappuccino before the match.
Yeah.
What is
So
what is the
caffeine,
importance of
another
that?
one that's super well studied. We know the risks. We know the benefits. I worked with track sprinters for a while, 100-meter guys, and we would actually do caffeine protocols before races. So we would actually max out what their caffeine tolerance was. So you'd have to do it for a week or two beforehand to get their tolerance. So a lot of these guys were taking very high dose, 500 milligrams, 600 milligram dosing. So for folks that aren't that familiar, a regular Starbucks coffee, double shot espressos, no more than 200 milligrams, give or take, somewhere in that zone. So if you're talking 600 milligrams, that's
Triple
5
it.
shots of espresso,
They're
6 shots of
Triple
espresso.
it.
So for a lot of people, that's too much. That gives them jitters. That gives them, heart palpitations. You don't want to mess with really high dose caffeine if you're not under supervision of someone that knows what they're doing and doing it, for a specific purpose. But 1 shot of espresso, 2 shots of espresso type of scenario that a lot of people do, that obviously improves reaction time. The data's on that. It improves explosiveness while it's in its highest levels. So you're talking about 30 to 60 minutes after use. If you take an espresso at 9 a.m. and play a match at 3 in the afternoon, you're not going to see much of a benefit. So it has to be in a pretty narrow window. The risk of caffeine is if you have too much of a dose, it does impact hydration levels. 1 shot of espresso usually doesn't if you're hydrating well, because you're getting plenty of fluid into your system. It's not going to affect it. It's not really a diuretic, which means you go pee it out more and you have to go to the bathroom more and things like that until you get a higher dose. For many people, that's 300 milligrams or higher. So it's not as risky, let's say, as I think some people thought it was 10 or 15 years ago, as long as you're hydrating. And that's the problem with many tennis players. They're not well hydrated. They go into matches not well hydrated, and then you can't make up for it when you're in the match. You're sweating too much. So caffeine's one of those ones where it's very personal. You have to understand, do you have any risk factors? A heart condition of any type, you want to be very obviously concerned about taking extra caffeine. If you get a rapid heartbeat, some people have that as a condition, you don't want to take extra caffeine, things like that. And you got to be careful, obviously, with caffeine late in the day. It may impact your sleep cycles. So if you've got a night match, taking caffeine at 6 p.m. for a 7 o'clock match sounds good maybe for performance. But if you're a caffeine responder, meaning that it affects you a lot, and you want to get to bed at midnight or 11 p.m., you may not be able to get to sleep, which may has a bigger negative effect longer term than the short-term benefit you may get from it.
And so there are guys out there these days that talk about nicotine, like they're popping Zins and they're doing sort of some things, I guess, to try to, calm the nerves. Maybe I'm not sure what exactly the effect is. And I've also heard about players back in the day, like smoking cigarettes. Like I've heard rumors that David Ferrer was like a smoker, even though he was the fittest guy out there on tour. What does nicotine do for athletic performance?
Yeah, so nicotine's been around in sports forever. I mean, when I was playing, there were guys that were doing all sorts of nicotine patches, not like they look today. They were a bit different. But in the 80s and 90s, that wasn't uncommon. The challenge with it is, so what's the reason? You see it in baseball and golf a lot. The reason it works a little bit in those sports is because it's not as physical. They don't have their heart rates going through the roof consistently like tennis players. They don't usually have to, play 3 hours with a elevated heart rate. They have a lot of their heart rates pretty low for most of their environments. The challenge with nicotine is it does improve cognitive function in a lot of the studies. It improves reaction time, alertness. It can help with alertness in the short term. So those are some of the benefits, and that's why people take them, because it gives them that response. They feel like they're more alert. The big problem is it does elevate heart rate, which is not something you want as a tennis player. You want a lower heart rate at rest. You don't want it elevated, because that means every work session that you have, your heart's working harder and you're actually getting more fatigued. So it doesn't help at all from that standpoint. It's actually a big negative. If you do the dosage wrong, it can give you problems with alertness. It actually, like everything, kind of like caffeine. If you don't do it right, it can cause a lot of problems. It can create environments where you get a little paranoid, a little agitated, things like that. So that can be a real negative if you're trying to calm yourself, if you're trying to do these things. So it's definitely not something that I ever recommend for tennis athletes. It's not good for the sport of tennis because of the environments and the need for good endurance, heart rate control, things like that. Other sports, it may have a bit of a benefit because it's not banned. It can be utilized. So that's why people experiment with it.
And
sorry.
No.
So in your opinion, creatine is about the timing and the dosage. Caffeine also about basically timing and dosage, and then nicotine, stay away from.
Yeah, for tennis players, there's too many risks for it without much of a benefit, and the benefit is going to be offset by the risks.
And
Justin's going to ask about alcohol next. Watch.
No. And the big boy, the one that everyone's talking about, I've had players come to me on the Futures Tour, Challenger Tour. We've heard the big tour talking about it as well. Adderall. Is it the Limitless pill? Is it this cure for everything? And is there and what are the benefits and again the downsides to the Limitless pill that is Adderall?
So Adderall is complicated. Like it's really one that you have to take it very personal because obviously it's designed for a specific purpose. And many players would qualify under first off, in tennis at the highest levels, it is banned without a prescription. So you need in competition, you need a therapeutic use exemption for a prescription for Adderall. So that means it needs to be prescribed by a doctor and that prescription needs to fit a few criteria. The athlete needs it based on the doctor's evaluation. They've tried other strategies that doesn't require medication first to deal with. It's usually prescribed for attention deficit hyperactive disorder, ADHD. So many people do have that. So it's not something where players don't have that. They actually would qualify, but it's very much a personal decision. So you need to work with a professional to define if that's necessary or needed. Obviously, in a lot of sports, people may be taking it when they don't really qualify and they're taking it purely for a performance benefit. But there's a lot of negatives to it. Obviously, it helps with focus. It allows people to concentrate usually better, which for tennis would be a valuable addition. The challenge is it usually offsets other things. And many players that have tried it have gone off it after a period of time because they haven't felt comfortable on it. They felt maybe better in one area, but they felt worse in other areas. So it's very much a personal discussion. It's very difficult to say people should or shouldn't do it. It's very much, you got to get evaluated by an expert. You've got to understand where it could help you, which it definitely could for many players, but it also could put you in environments that you don't want to be in from how you feel and things like that. And there's players that obviously will try anything if they think it's going to give them a performance edge. You see it in other sports. College football, it's utilized a lot many times because they need to memorize plays, they need to do all of that type of stuff. But again, it's got a lot of risk to it. It's not something that is just good without any negatives. So that's where we have these discussions broadly. It's always challenging. I always say you got to work with a professional who's an expert in sport as well, because the negatives of any type of ADHD medication is on how it can impact other aspects. What happens when your heart rate's going through the roof? Many of these players that do it, their heart rate does change as a result. And sometimes they have issues with anxiety and other things as a result. So you have to make sure you've got someone who's very much able to understand that and deal with that. So it's not a simple answer.
Yeah, I've heard guys tell me that they were playing unreal tennis, but they couldn't sleep. They had no sex drive, and their personality changed. Like they would be in the locker room, people would be talking to them, and they would be spaced out. But when they went on the court, they could really play tennis. But everything else kind of got a little weird for them in their life. So it's not quite as I mean, I guess it's beneficial in that way, but it's not quite as magical as people might make it seem when they talk about it so loosely.
No, it's definitely not without its risk. There's no doubt about it. So it's one of those ones where you should never listen to anyone online give recommendations on prescription medications. That's usually my take on this stuff. So if anyone's listening to this and they're making a decision on it based on what we say online, that's a bad idea.
I made a joke. People need a certain UTR to comment on people who are professional tennis players, tactics, whatever. So you're saying, talk to somebody who has a PhD or like someone who's an actual doctor before you make these decisions. Don't
typically
just
a sports psychiatrist is who you want to work with. You want to work with someone who works in sports and typically is an MD that works with ADHD patients and understands both aspects. They just work with ADHD patients, they're going to probably not understand the physical demands of the environment that sports puts on them, which is a whole different discussion.
So, kind of run out of time. So I think no game today, but I do have 2 more questions on supplements, quickly.
No games, that's a blessing for me.
Yeah, he normally gets embarrassed every week with the trivia, but it's okay. We'll bring Kovacs back and we'll do something different. But is collagen underrated? I asked because I heard about it. Not from a doctor, but just online, right? So, but I
that's your first mistake.
But I had like on the top of my foot, the bone there was sore for like months, and people were telling me about collagen and how it's good for the bones, hair, nails, whatever. Like maybe it might have saved Jody's hair for a little longer if he was taking
That's
it.
unacceptable.
But my foot was hurting for a long time. I was taking the collagen, and after about 2 weeks, the pain kind of went away. So is this a good supplement to be taken for people, especially in tennis when you play on hard courts, a lot of pounding, start, stopping. Should people be taking collagen as a part of their protein intake when they're training and playing tennis?
So collagen has some benefits. It's maybe overstated for soft tissue, for tendon stuff, which is what it's talked about a lot. It's one of those things that has low risk. So it's definitely something that we discuss, but it's not something that I would say everyone should automatically take. But it's definitely something that is in the repertoire and could be utilized. So there's a lot like that. I put it in the B category. So I have A supplements that pretty much most people should take. It's going to provide value. Then there's B supplements that for some people it could be valuable to do because there's low risk and it could help. And then you've got most of everything else, which is C and D stuff, which probably doesn't help you.
So that was my last question. What are those A supplements? What should everybody probably be taking that would be beneficial to them?
Yeah, without blood work, it's a little hard to say for sure. But in general, I always say you want to get your blood work done to make sure it's personal to you. But overall, most people are low in vitamin D. So vitamin D is really useful. Omega-3s is really good for brain function. It helps a little bit with recovery. A good protein powder, high in leucine, which is the major amino acid that you want in your protein powder. So those are the 3 sort of daily things. And then depending on the environment, creatine is going to be probably in there for training weeks, not always during competition, but for training weeks many times.
And when you say blood work, what does that mean? Like what kind of test is that if people want to know?
Yeah, so the blood work's kind of complicated. That's my background. Okay. I did my PhD in blood and sweat work. So you have sort of regular blood work that people get for medical once a year, just to make sure you're not dying. You know, you don't want to have levels that are really low compared to health reasons. But then you have performance blood work, which is how do athletes maximize their environment so that they're less sore, their inflammatory markers aren't high, they can sleep better, they can process their energy better. So there's we can have a whole show on that if you want to talk about that.
One more. Sorry, go on, Justin.
No, I was going to end it.
One more quick question. I know you have to go quickly, but can we just quickly talk about hydration? Is there any, I guess, key tips and tricks that people should know about hydration? Because I'm a person that I sweat a lot, so.
The biggest problem with hydration is you can't replenish for most players enough on court on what you're sweating out, especially if you're a heavy sweater, like it sounds like you are. So you have to go in ahead of time, 3-4 hours before your matches, to make sure that you're well hydrated. and making sure you've got enough sodium in the fluid beforehand, because sodium keeps more fluid in the body. That's why adding sodium to your drinks throughout the day is really important. That's kind of the standard recommendation because it has 50 plus years of good science behind it.
Okay.
Dr. Mark Kovacs, this was the serve and supplements episode. I think we could break down so much more with you. So maybe we'll have you back on like a quarterly thing. Maybe we'll just break down the forehand and the backhand.
For sure, happy to. You guys keep up the good work. It was great catching up.
For sure.
Thank you so
care.
much.
No problem.
Thank
Great
you.
speaking. Take care.